Hi, all. Thanks so much for joining us on Speaking of Making Healthcare Work for You. I'm Stephanie Fields, joined by my co-host, Dr. Apurv Gupta. And today we are talking about the interview we did with Dr. Dalila Lewis, who is the Division Chief of Pediatric Neurology at the MUSC Shawn Jenkins Children's Hospital. And it was such a great interview. Dr. Lewis has been at the Children's Hospital for, I think, less than a year or just over a year. It was August, but I'm not sure of which year. And she's made a tremendous impact, taking the wait times for patients from sometimes 8 to 9 months to sometimes now just a few weeks. She's expanded their team, and she's really taken a holistic approach to changing the face of the way that that department is working. I liked how she talked about the leadership within her own team and being able to use the collaborative care model that Apurv, you and I have talked to so many other people we've interviewed about, how important that is. She really embraced that and being able to allow other providers on her team to function at the highest level and making sure people are seeing the right people, incorporating herself into the schedule so that she's able to talk to these patients and also see what these other providers are experiencing. And she talked a lot about how important it is to talk to the patients as people, see them as people, not as patients. And it was just a great interview. She really has such a great approach. And I also liked that she has a child who was a premature baby. So she understands what it's like to be a mother sitting there scared. And gosh, the first female of color leading this department. I mean, she is just blazing trails through this department up and down. I love it. Apurv, what struck you?
I love it. I love it, Stephanie. I'll pick up from just what you said, blazing trails throughout the department, being the first female leader of color. And yet when you speak with her, there's nothing that she's giving up in that. She's just a leader, right? So sometimes we need to emphasize that she's the first female or she's the first female of color, but she's just tremendous leader is what I would have to say. You can see that in her entire approach, in her military background, to the way in which she's trained herself for leadership. The way she, emphasizes listening to people, making sure that they feel heard, not only for her patients, but also for her colleagues. What you already mentioned, Stephanie, about putting herself out there on the front lines, being part of the solution, not just being a leader that's going to come in, assess the situation, and give orders. She said, she compared that to her military background, where the best generals have to have had some field experience, and they need to be able to relate to the people that are in the trenches. So I think she does a tremendous job, and is probably a hallmark of her success, because she is able to be out there on the front lines and really understands what it means like for a patient not to be able to get seen, or for providers to feel frustrated because their patients are not able to get seen. So I think that's what really struck me, is her overall signature leadership style. And the second thing that I think really struck me is that she was somehow able to figure out that she had a big hill to climb. Right. She had a huge turnover that you had mentioned, Stephanie. She had a huge turnover in the department, morale issues, access issues, and yet she was able to wade in there, and with some patience and determination, she was able to figure out that if I can somehow improve access, that can help really get other people on board, help make the staff feel better about what they're doing, help make them more engaged. And then she's, started becoming creative about how she did the staffing. So I think that her problem-solving abilities go hand in hand with her leadership abilities, and I think make her a great role model for her staff and for her residents and for all of our viewers.
Absolutely. I completely agree. I love that MUSC's motto is changing what's possible. And by hiring somebody like Dr. Lewis, they're really doing that. Well, thank you all for watching, and stay tuned for the full interview with Dr. Lewis. Talk to you soon. Bye-bye.